Oh, posture. It's so important to your health. We talk about it often on our show. Yes, we know we have to sit up straight, watching that bending over when texting, and using that computer all day. But is that all we can do? Doing exercise is also an important element to maintaining a proper posture. So let's join Dr. Jerome Raruca. He has a series of exercises you can simply do at home. This is so important, it'll actually be a two-part series, so make sure you watch part 2 next month. Dr. Jerome is raring to go, so let's clear the floor for Dr. Jerome.
We're going to discuss posture and implementing clinical exercises into your chiropractic program to enhance benefits to their maximum potential. Now we're going to bring Penny in here. And when we are looking at posture, we're going to show you what ideal posture is first. And so when we look at how nice and relaxed she is in what we call a neutral position, and her shoulders are back, if we look at her from the side, we can look at the mid part of her ear, bisects her shoulder, comes right through the hip, and goes right through her ankle. Now this is an ideal posture, and there is a lot of benefits for this. And so as we look at a lot of reasons why people have pain, it's because of these asymmetries and abnormalities. To one of the common abnormal postures that we see is an anterior head tilt. If it gets bad enough, the shoulders will round forward, and they can even have a significant hump in the thoracic spine, referred to as a kyphosis. Now, even though you clearly see the symptoms on the upper body, we also want to remind you that the pelvis can be involved in this corrective process and this negative process as well. So one thing to be aware of is the pelvis can also tip anterior, which also affects this upper body abnormalities. Now we're going to show you how to correct this. So as we're looking at her abnormalities here, in order for the shoulders to go forward and to have an abnormal curvature here, these muscles have to get long and they get very weak. In the front, when these shoulders round forward, these muscles are short and they get very tight. So we're going to increase the flexibility in the front and strengthen the back. Now there's over 160 different chiropractic techniques. However, all of these chiropractic techniques all encourage us to try to have and correct us into this ideal posture. So this is no substitute for an adjustment. Actually, the adjustment works very favorable for these corrections, but we're just going to help the adjustment by implementing some of this, what we're going to share with you. So we're going to start by using some rubber band exercises. Now, as we described, people have a weakening of their back muscles, which allows the head to go forward and the shoulders to round forward. So very simply, we're going to use rubber bands, and it's good to have patients do this up against a wall, because then even if their posture is off, you can put the back of their head, the back of their shoulders, and their butt up against the wall to recreate this ideal posture. And we're going to have the rubber band to where we always keep tension on the band. You're always going to have your elbows straight, and we're going to aim for the clavicle. And you're going to extend your arms all the way back, squeezing the posterior muscles, holding it for about 1 breath. And you're not going to go too fast or slow, but controlled motions, always keeping tension on the band. And you're just going to go through this very rhythmic exercise. And you're going to do sets of about 6 to 10, depending on your capabilities. And once you contract the back, instead of just taking a break, we're actually going to take this time to stretch the front. Now, it works really good to have a door jamb to use this on. And so since these muscles have become so short, you can just very easily take one arm in between your first set and just gently stretch. And you're going to feel that stretch just in the front area of your chest. And remember how your shoulders are rolling forward and that head's coming anterior, and this is going to help correct that. And you're going to do both sides. Now, after you stretch each side for about 20 seconds, probably working your way up to 60 seconds, you're going to come back and we're going to do another set on the back side. Now, last time we took our palms and they were face down. We're going to use different muscles by using a different grip. And we're going to put the palms up We're going to maintain that similar posture up against the wall, keeping tension on the band, always having our elbows straight, and this time having the palms straight up. And this will feel different to you. You're going to be using different muscles. Still controlling the exercise at all times, breathing in a relaxed way, holding it once it touches the clavicle. And again, doing about a set of 6 to 10. And as you take a break, you're going to then stretch the front. So this time you may find your way to a door jamb to where you can stretch with both arms. And this is going to be a little bit more difficult. You're going to feel it's easier to stretch one arm at a time than using both arms. Now again, the different angles you stretch with your arms is going to stretch different muscle fibers. So you can start when you're straight across or at 90 degrees. If you increase the arm height, you're actually going to stretch different muscles in the shoulder and pec area. And again, this is very important to correct some of these asymmetries and to maximize these corrections that we're going to provide. Another exercise then, after you're doing that stretching exercise, is to come back and we're going to take our thumbs, put them in the same direction, go up against the wall, and we're going to work a diagonal. So once again, we're using different muscles throughout the entire spine. We're strengthening the spine, and we're correcting these abnormal soft tissue patterns that relate to this abnormal posture. And you can do both sides, switching the thumbs, going the other side. And again, doing a set of 6 to 10 per set. And you can ask your doctor as far as how many sets of each you can do and just work a simple progression. So these are things that work fantastic for people who have never exercised and they're just being introduced to chiropractic care and the importance of rehabilitation. Even if you're an elite athlete, these are the things that maintain ideal posture and are great for warming up prior to significant exertions. Whether you play any kind of open skilled sports or you're an elite lifter, these are the same things that are used throughout those types of specialties. Now, as we look at the different bands that can be used, they come in a variety. Many people aren't aware of these that we're showing you right here. Now, in the athletic world, these are very common. In the rehabilitation or clinical world, you can't generally buy these at sporting goods stores. You can easily find these in information on my website with those. However, there are other things that you can use as well. So these are pretty common for people. A lot of clinicians have these already. Some people like the handles because they can be a little easier to hold on to. But again, as we look at using the different grips, even if you have to use the handles, you can still come inside and you can absolutely use the different grips even just on the cords themselves. Another very common one that's used out there is TheraBand. These have very little resistance, so sometimes people definitely, when you get into other patient populations, these don't have very much resistance. And we literally want this to be clinical exercise. We want to start at a very low safe level, and our progressions should not only significantly change and correct this abnormal posture, but it should also increase our strengthening ability, and we are just going to have much longer term care and benefits. So again, if you apply this into your current treatment program of what you're doing with your chiropractor, I guarantee enhanced results for postural correction and also strengthening so less reoccurrence of your injury will occur. Have a great day.